My name is Federica Porcu. I'm Innovation Project Manager at ECH Alliance, and it's my pleasure today to introduce to this session titled Collaboration and Co-Creation, Common Points between the 4PCAN and the SIRENE projects in engaging local communities. The aim of this session is to explore how these two projects use social innovation for engaging social communities. This project that apparently are very different for PCAN is focused on cancer primary prevention, is funded by the EU Cancer Mission Program, and SIRENE aims to support the growth of social innovation actors in eco-friendly and sustainable community-based services for SHAFE implementation. So the idea is to see the key points, the points that these two different projects have in common, but also to understand how maybe these two projects can learn to each other. So let me show you the agenda of today. We will give the floor first to Karina Dantas, CEO at Shine to Europe and SIRENE Project Director. Then we will listen to Marius Ganta, Director of Innomed and 4PCAN Project Coordinator. And then my colleague, Dimitris Georgoulis, will moderate the conversation. So to all the participants, if you have any question, please write them in the chat. So Dimitris, after the presentation, will ask the speakers your question, and please consider that this session is recorded and will be available on the SIRENE project website. So if you don't want to appear, feel free to change your name and switch off the camera. So I will give now the floor to Karina, who will explain us better about the SIRENE project and how about the social innovation framework built within this project. Karina, the floor is yours.
Thank you so much, Federica. Thank you also to Marius for being here today with us and being able to engage in sharing insights and project experiences. This is always a very nice way of starting a webinar, which is to already put in advance that we'll be able to discuss between us and have new ideas possibly coming to the ground. I hope you are seeing my presentation. Let me see if it gets well. Yeah. Okay, so I will try to be a bit painless, I hope, in presenting the project and going a bit more on trying to detail the framing and also how we got to SIRENE, because at the end it also came from already in the beginning from some bottom-up needs, and this very much relates to the whole idea of engaging with local communities. So from a long period, a lot of us have been working the same with the ECH Alliance, with F6S, with Innomed, and a lot of other people that are here. We have been working on trying to implement better solutions for citizens, trying to implement more inclusive communities, things that work and bring more health, better lives. And of course that during this period and during this pathway, we always understand what are the challenges. And many years ago, we understood that one of the main challenges that existing was that everyone was working in silos. I'm very sad to say that this still happens today, but our main work is exactly to try to put collaboration to place. And the SIRENE project was born under this idea of smart, healthy, age-friendly environments. This was a concept, let's say, which is not that far-fetched. It just means that we should put health, social care, the building environments and the environment itself, technologies, policy and funding all aligned and working with the same purpose. Actually, this is so basic that it resonates to a lot of people, and we had this large stakeholders network presenting a joint statement to the European Commission and the member states in 2018, which was supported to a very big range of organizations. And the main point of all of this, let's say, policy push was to try to promote that at the regional, local, national, international settings. There was more strategic collaboration between the different sectors, and that policies were actually developed together. In Portugal, our President of the Republic was actually supporting SHAFE and a lot of other eminent figures around the world. And this is because, as I was saying, the concept is quite simple and easy to grasp. The overall idea is that if we have different challenges to being able to live in a way that is healthy, inclusive, and pleasant, what we need to do is to understand the different challenges during the life course and to try to support people into being able to respond to them the better way possible. This is the whole idea of SHAFE, is to put all of these different aspects together and approach them as one sole approach. And this is very much connected with this idea of active and healthy living, which means that our role in society is as much as possible to try to support people to have the physical, the social, emotional, even spiritual support to be able to be integrated with the society, be able to be working with each other and have the knowledge, the resources, and the environments to foster a healthier way of living. So this means, for this to work, this means that we need to put together a lot of things. We need to have good knowledge, we need to have policies that are evidence-based and that understand the outcomes of research to be implemented. And also, of course, people in general will need to have reliable information, need to be empowered, and need to have tools to be able to address their challenges. One of the key approaches that we at SHINE understood was really important was social innovation, and this is a bit how it also was brought to SIRENE as one of the basic elements. But SIRENE was not built out of the blue, let's say. It came also as the outcome of a long work done within a cost action, which is called Net for Each Friendly. Net for Each Friendly was born on the SHAFE concept. It's almost ending. It will end at the end of October of 2024. And it was born on this concept of SHAFE. And because, as you saw before, we had a lot of different people and organizations being engaged in this concept and eager to do something at the local level. But there was some kind of framing or collaboration missing at the international level. So the cost action was kind of giving the framing for this to understand how we can all work at our small world, local level, regional level, but then find a way to collaborate with others internationally. And on the other side, from, let's say, the transnational perspective, we could also, during the cost action, be able to exchange with each other how each of us at the local or regional level could also engage further in our network so that we have a good representation in whatever we do, in whatever our work is, of the policymakers, citizens, industry, scientists, NGOs, and all of the needed actors. This was interestingly recognized as a good practice by the United Nations. It was one of the practices selected as a good practice within the SDGs, the Sustainable Development Goals. And we had the opportunity to discuss this last year in New York between the COST and the United Nations General Assembly setting to promote a bit further the idea of going broader from SHAFE, more European-based, also to other settings and continents. At the end, the overall idea of this concept is that again, collaboration goes in several ways and between several domains, and we need to make all of this work together. So we were in the middle, let's say, of the development of the cost action when we saw this call for integration of social innovation actors in innovation ecosystems. And at this time, it made so much sense that this could bring some missing points for the development of the work around SHAFE. So here the main point was to try to connect those more industry technology oriented, such as the innovation actors and ecosystems, for example, SMEs, research organizations, etc., and connect them with social actors, for example, social entrepreneurs, NGOs, and civil society in general, and to do this through social innovation. So this is how SIRENE was born. SIRENE is also ending in October 2024, so an interesting coincidence with the cost action. And the main idea of it was to try to bring social innovation as a way to reach the communities and promote inclusive, green, and smart housing and environments. We are, well, let's say, I won't put the whole concept of the project here because it would be very boring, but the whole idea is that on one side, we try to put forward a framework for different actors to connect. This is the social innovation framework. We created, in this case, grown a network of experts and local ecosystems to be able to be starting the work with each other and hopefully to keep it for the future. And this links directly with the third pillar of the project, which is this sustainability strategy that would allow different actors to put their eventual solutions or services in place and ensure that they can be prolonging the effects of the project in the future. SIRENE has 6 core partners, a number of them also here today in the call, which are spread around Europe, but it also has some more. So on the side of the actions, we have 3 main angles, which were related to the 3 pillars, which is the social innovation framework. As I explained before, it is divided in 5 components: the blueprint of good practices, a capacity building framework, the sustainability strategy, a toolkit for hands-on work, and a manual on social innovation. But this is, let's say, a bit the theoretical framing. It can, even if it is done in a very, I hope, interactive and not fully scientific way so that everyone can take advantage of it, it is more connected still to knowledge. So to put this in practice, there was a lot of other tools available. We have a digital and expert hub that I will explain in a second. Also a repository for putting together all of the knowledge that we gathered, but a lot of different activities such as science cafes, video pills, webinars, info packages, etc. And today is one of these examples. Well, all of this is supposed to be put together so that at the end we have a nice result. And the social innovation comes into the discussion because from the beginning, everything we did was done together with our expert hub and with the local ecosystems. And this means that the 5 components I was showing before, the information packages, all of the different tools that we have been developing, the repository, the hub, all of them were put to different moments of co-creation, testing and validation with a broad range of people around Europe. And the idea was that at the end, we didn't do anything together alone. We did everything together so that hopefully people will actually find them usable and useful in the future. From the expert hub, which are also in several cases the representatives of the local ecosystems, we are almost reaching 60 experts and they range 33 countries. So this is actually, for a small consortium of 6 partners, this is how we make sure that things are connected to local, regional, and national settings. The experts were a bit the ambassadors of the project in several aspects, and they were also those that were collecting the feedback of their communities and bringing them to the different things we were developing. At the end, and this, as you can see in this image, is the structure of our data repository. At the end, we had experts from all of these different areas of knowledge, and this means that we were able to really discuss all that was needed to progress with SIRENE aims. In terms of knowledge, we also went through a lot of discussions because, as you can imagine, having a lot of experts involved also means that we have a lot of interesting feedbacks, inputs, and co-creation moments. So for the state of the art in general, we tried to do a deep assessment and also understand the needs and gaps that were existing. And in most of what we have, well, again, I don't think I will say anything new, but it was, let's say, a bit disappointing to see that some of the main gaps that we encounter are still the same as they were when we started the SHAFE network in the beginning. A lot of the issues still come with a lack of communication between the sciences, business, and the community. And also, a lot of the areas more connected to social sciences are still not that much embedded or involved in the technological side. We have been working around this with a lot of our experts, but at the end, and coming to the main core of the discussion today, what we found was that the biggest issue to reinforce is the local and regional ecosystems. So at the end, any cooperation that goes beyond this is very important. The transnational collaboration is a key issue to evolve, but most of the local, national, or regional settings are still missing a lot more of collaboration between the different areas. And those that are here in red, academia with other types of organizations, individuals, and especially civil society is still lagging behind. For this, we think that having initiatives such as SIRENE can help people to understand the importance and to go back to their own ecosystem to try to bring it forward. But of course, this is not enough, and more local support is needed. A lot of the different organizations actually also involved in SIRENE do this as part of their work and strand of knowledge, but there's still a lot to do. And we do hope that this whole idea of nurturing the collaboration between the organizations that are around you is something that will be kept in SIRENE's legacy. So to try to make this very concrete, one of the tools we have developed was the Garcia family. And we will be using this for the future, I hope, just to try to make all of what I was saying more clear and simple to work with local communities. In this tool, let's say, what we did was to try to identify a common family in Europe, try to give them all good assets, but also challenges, namely related to health or to work. And then we discussed this with the different groups and tried to explain why all of the challenges around the family are actually multidisciplinary and demand for a more integrated approach, let's say. We will be doing some workshops on how to apply the Garcia family in place, but at the end, a lot of the things that are citing outputs can still be reachable by anyone interested, and I hope they will support in different ways the different actors around Europe that want to implement more social innovation in their ecosystems. At the end, all of the legacy of Net for Each Friendly and SIRENE will be taken to the SHAFE Foundation, so we still hope to keep all of the things that have been developed available and usable by anyone who wants to do it. And if you want to know more, we have the final event of the two initiatives next week, so quite close, in Brussels for 3 days. Incorporated in this event, there will also be a training for people who want to learn how to use the Garcia family method, but there will be a lot of panels, and I'm very happy to say that also Marius will be joining us in the event and share some more of his expertise. I think from my side, that was what I had to say. I hope I was more or less on time, and I'm happy to pass you back the floor, Federica.
Thank you, Karina. Thank you so much. You were definitely on time. Perfect timing. I will give the floor to Marius now.
Thank you so much, Federica and Karina, for the invitation. Very happy to be here today with you. Yes. I'm very happy to be here today with you to share more data on community engagement coming from the 4PCAN project we are coordinating, and listening to you, Karina, with all the frameworks you worked and you developed in the last years. Actually, my presentation will be a very practical one, coming from the first year of implementation a living lab around cancer primary prevention in a small village in the center of Romania. So I think the people who are listening our webinar will be able to have both perspective, let's say the very high level you already presented, and a very practical one. And I think we'll find a lot of synergies and many ways to move forward. Because I think it's really important on one side the frameworks to inform the implementation at the community level, and the other way around, the learnings coming from interacting with the communities to contribute to the adaptation of the frameworks. And speaking about this, for us, the biggest opportunity was the cancer mission. And I had actually the chance to be involved in the development of the cancer mission starting 2020, 2021. And in a webinar in February 22, organized by us, by Center for Innovation in Medicine, I invited Professor Christine Chomien, the Vice Chair of the Cancer Mission Board. And Christine mentioned that it's time for the next level of engagement, the engagement with the citizens. And I was not surprised, but very happy to see that the cancer mission is moving so bold in the direction of the citizen engagement after many years of a discussion around how to put a cancer patient in the center of everything. I think is not the right place to discuss about about the results of putting the cancer patients in the center. So this was for me a big inspiration, and actually this inspired us with the 4PCAN proposal on the calls for proposal under the cancer mission come out in actually 2 years ago. In 22, we decided to put forward the proposal on cancer primary prevention called 4PCAN, personalized cancer primary prevention research through citizen participation and digitally enabled social innovation. The idea was a very simple one. For almost 4 decades, we have the European Code Against Cancer with very clear recommendations. And after almost 4 decades after the first edition, the awareness of the code and the awareness of some of the recommendation is very low. And the idea was to try to imagine a model, a bottom-up approach, contributing to a model aiming actually to increase the implementation of the code, knowing that the European Code Against Cancer 5th edition will be launched in 2025. 4PCAN project is intersecting at least 7 out of the 13 cancer mission recommendations. And for our today discussion, I think the recommendation number 12 is relevant, creation of an oncology-focused living lab. And the 13, transforming the cancer culture, communication, and capacity building. I have to say that we are now 18 partners from 11 countries. Very happy to say that European Connected Health Alliance is part of the consortium. And in the project, we are looking on the cancer primary prevention from policy perspective, on one side, from economic perspective, measuring the direct and indirect cost of cancer, in different countries. Then at the individual level, we are trying to understand how the attitudes and perception and preferences of the citizens influence the uptake of European Code Against Cancer recommendation. We implement in the project the model of personalized communication, considering the micro, meso, and macro level of communication, and at the same time engagement. And as I mentioned already in the project, we started to implement a living lab in Romania, and another one will be mature probably next year in Bulgaria. Okay, so for the Romania Living Lab, initially we put in the proposal that we will set this living lab in a county in the center of Romania. But then when we have been in the position to start our activities, we very early understood that um, one size doesn't fit all, even at the county level, because you have the capital city, you have other cities, and many rural areas. And we decided actually to start the activities in the living lab in a small village in the north of this county, around 4,500 inhabitants. In order for us to understand and to test some social sciences tools, and yeah, to start to experiment. And the living lab framework and approach, I think, is really great, because this allows you to experiment and to test different hypotheses and to adapt your intervention. This um, focusing on this county is relevant because this county and the entire region has some particularities. The most important is the low access, in principle, to high level or good quality healthcare in this region, because there are no medical universities, no medical hospitals, and in order for the people in this region to have access to good doctor, good medical clinic, they have to go actually to the capital of Romania, to Bucharest. Then it's relevant the living lab in the rural area in this village, because a lot of people actually in the EU are living in rural areas, and this proportion is higher for Eastern European countries. And in rural areas, the access to health and care is very low. And in rural Romania, 80% of people should drive at least 15 minutes to have access to a healthcare service. Not mentioning the digital divide and how difficult it is for the people to take the advantages of different digital health tools available at scale. So far, actually, in less than 1 year, we completed the first 3 iterations in the living lab. And from a community perspective, the extensive stakeholders mapping was one of the first key parts, and establishing the citizen jury was the second most important part. This was so important because we, in our approach, we consider to enter into the community on one side, trying to understand at the stakeholders level who are the local authorities more interested in this topic or less interested, and so on. And on the other side, we enter the community through a citizens level, actually trying to identify in community citizens interested in this topic, and then these citizens recommend others, and so on and so on. I mentioned that we map the stakeholders, and for the European Code Against Cancer, actually we identify far more stakeholders than are considered in traditional approaches on implementing the European Code Against Cancer. So we identify around 130 stakeholders, compared with up to 10 in the traditional way. So the picture is so complex, and we divided the stakeholders in traditional and non-traditional stakeholders, because let's say for physical activity, the sports club and so on are relevant for the topic and might not be included all the time in our public health strategies. On the other side, we use this pentahelix model of collaboration, trying to consider some categories, and so important to identify who can be the driver of different activities, or in our case, around one or another risk factors. And as you can see in this picture, what we actually identified is the disconnect between at the national level. So things are very clear at European level, very clear regional and local level, but at the national level, actually, it's a disconnect between European and local regional level. So I think this um, lead us to the idea to better link the European opportunities and local regional realities in order to have a real impact, and not to go all the time through the national stakeholders, national paths, and so on. In terms of governance, I already mentioned that we use the quadruple helix or pentahelix model of collaboration, and the key is this the role of the orchestrator. And our conclusion was that the traditional linear implementation model of cancer primary prevention is really obsolete, and we should think in a totally different way in order to have an impact. For the citizens, we use advanced social sciences tools, personal and social network analysis, in order to understand the specificities, the attitudes and preferences and expectations of the citizens before actually implementing campaigns around European Code Against Cancer. I mentioned that we are using in the project the personalized communication model, which is heavily informed by the data collected through the social and personal network analysis, and this is one of the key messages. If you go at community level, you should choose carefully the social tools you consider to use. This is so important because first of all, you should assess the local environment before coming with a campaign, before coming with a project, with an event, and so on. And this is a very nice picture with the mayor in the village at one of our events organized in this community. I mentioned that it's crucial to choose the right social sciences tools, and for us was essential. Because we have to implement campaigns around European Code Against Cancer. And data coming from this analysis, this social analysis, show a very high level of stigma and fatalism, and a tendency of the people in the community to protect the cancer patients and not to expose them. Not for the research purposes of public events and so on. So for us was a challenge to introduce in the community European Code Against Cancer. And at the first meeting, we decided to speak with the people in the community about the 4PCAN project as a project on research and innovation, and not mentioning the European Code Against Cancer from the beginning in order for them in order for us to somehow to build some bridges of trust and common understanding. And the reaction was very good, and people at the end of the meeting expressed their interest to join the citizen jury and to contribute to our activity. So this was part of the first iteration. And in this meeting, in this town hall, we succeed to understand the priorities of the citizens, and they choose from the 12 European Code Against Cancer recommendation. They choose 3 of interest for them: obesity, nutrition, and physical activity. And we actually build the second iteration in the living lab around 3 topics of interest. So compared with the traditional ways of implementing campaigns around European Code Against Cancer, we decided actually to build a campaign for the topics of most interest for the community. And I already mentioned the very high level of fatalism and stigma, and we decided to launch a campaign called Code for Life. In other words, to try to send a positive message to the community around the risk factors, and of course, to say that this will help them to prevent cancer. But we didn't put the cancer word or references to the cancer from the beginning. So this is the way we see the implementation of the personalized communication metrics here. And from the second iteration, we extracted other relevant information. And on the third, we organized a big intervention in the community called Festival of Health. And we worked with primary school kids, secondary school kids, elderly people, parents, actually all the target groups in a community around the same topics of interest for them: obesity, nutrition, and physical activity, and with some really innovative approaches on this. So the key message from this slide is that before going in a community aiming to implement a campaign, you should always start with a deep assessment of the community, of what is happening there, and it's so important to use the appropriate social sciences tools. In our case, personal network analysis, but other social tools can be used, of course. This is, I think, the way to go, especially in areas that are traditionally neglected, like rural areas or other vulnerable population and so on. So you do not have detailed informations about this. So first of all, you should generate the information, and then this will help you to implement the campaign. On the community engagement, I very much like the picture on the right side of the screen. Are the members of the citizen jury in the community. And there's a sign of their engagement in our activities. At the end of the first town hall, I asked who is actually volunteering to be part of the citizen jury, and around 10, 12 people raised their hands up. And I said, oh, that's great, but you didn't ask me, what you are supposed to do as a member of the citizen jury. And they said, no, that is not important. We would like to be part of this. So if you are thinking from a cancer mission perspective, and the idea to be able to capture the activation of the community, to keep the community activated, and to be able to capture the short and long-term impact, and sometimes to anticipate what the short and long-term impact of your activities could be. So I think this type of reaction, it's a great indicator that you are on a good on the right track for your activities. And I have another example on I think a very early sign of success, but as well a very practical example of what the short, in our case, short-term impact of our activities could look like. So organizing a town hall with the citizens, okay, you might think maybe you can identify some people interested for the citizen jury. Some of them might be willing to share some personal stories about, I don't know, obesity and so on and so forth. But you definitely do not expect for the coach of the local team to call you and to say, we like to display the 4PCAN logo on our t-shirts. And then to play with these t-shirts in the fourth league, actually across the entire county. So this is, I think, a great reaction. It's so important on one side to capture this from the project perspective and from the cancer mission, in our case, perspective, but it's a learning on how to, when you design an intervention in a community, to think how this type of activation can be somehow stimulated. Because this is very important. Football, it's a language actually understood by all of us. So these are some of our activities in the Living Lab around citizen engagement. But what we actually missed was this framework. What citizen engagement means, in fact, what are the attributes we should look for when it comes to citizen and community engagement. And this code of practice coming in July from the European Commission is, I think it's a key document because the European Commission highlight the key areas, key points you should have, you should take into consideration when you design a citizen engagement activity, from how to design the strategy, how to build synergies, and so important is this part of understanding the expectations of the people in the community and understanding the incentives. And you, Karina, you address this topic of incentive, but it's not just about incentives. So I will end my presentation saying that it's so good to see the citizen engagement, community engagement, social participation actually mainstream now in 24. And I think this is a sign of change, and hopefully the citizens and patients will benefit more with these bottom-up models that I'm sure that will come in different areas. Back to Federica.
Thank you, Marius. Thank you first for accepting our invitation, and second for sharing in a very practical way the experience of 4PCAN with us. So I give the floor to my colleague Dimitris Georgoulis. That, I don't know, you have some question, Dimi.
Yeah, thank you, Fede. We have some questions for our speakers. Thank you both. Very interesting projects and impactful projects. So our first question is for Karina. What role do local communities and stakeholders play in the successful implementation of SAFE initiatives?
Well, at the end, even if it looks like SAFE is a concept, it's really not. Is everything goes around being able to take all of the wonders that we see are being developed and organized and done throughout the world, being able to say that we have it in our neighborhood, we have it in our house, we have it in our hospital, we have it in our street. I usually say this to remind people that I'm already quite old, which is when I was young, I remember hearing that in 1999, because there was a series that was called Space 99, and people could teletransport. So this is this is still before the 21st century. So now, in current times, we should have cars that fly. We should be able to travel differently. We should have things that are able to cure our diseases instantly. This is a bit what we always foresaw for the future. The truth is that, well, none of this exists, at least per se. But I see a lot of wonderful innovation every time I talk to researchers. And if you go to universities or to big events where innovation is showcased, I mean, last week there were two Transformers in a conference, you know, the Transformers, the big robots. So there are amazing things everywhere. The big problem is that I don't have them yet in my usual life. If I want to go to the hospital, I may wait. Well, I'm now waiting for 1 year for one examination. And if I need to talk to my GP, maybe I don't get to do it in the same day. And I mean, I can go forever on all of the hurdles we have, even more if we go to health systems. So the main idea around Shafe is what can we do, all of us in our different roles as citizens and as professionals, to take good things into our daily lives, to actually bring innovation to people and to be sure that it is the innovation that we need. This is, I mean, this is the whole Shafe concept. So this is what we are trying to advocate for many years. It depends. I mean, there's no straight answer for this. It depends on what we need in different contexts, on what we can do, on what are the constraints, what are the priorities. But this is what we need to discuss daily, is how can I bring all of the wonderful things that are developed in the world to be able to benefit my community and the people around them. And this is how we all need to be engaged, again, as citizens, as part of our citizen duties as well, and as professionals in making sure that at least the more vulnerable are also heard in this discussion, because this is also a key point, I think.
Thank you, Karina. Now, Marius, how can the co-creation process with local communities be enhanced to ensure more effective stakeholder engagement?
So first of all, I have to say that I'm not a big fan of this co-creation, because, and I will explain you why. Because actually, each of us is living in a local community, right? And the ideal scenario is that, you know, somebody in a local community, in our case, is or interested in cancer primary prevention and become the main driver of doing something relevant and impactful at the community level, you know, on this topic. The other part is, and this is our case, we are trying to go in a community and to use this co-creation in opposition to the traditional way of, you know, as doctors to tell to the patients what to do because we know best. I can understand that it's a clear step forward, but the idea is not to slightly move from co-creation to a real empowerment of the people in the community, and first of all activation and then empowerment. So in other words, you go as in a community, you use different tools to understand what is there, and it's so important to identify who are the influencers and then to empower them with your tools, with your networks and knowledge, and in this way they the local people can have a real impact, because otherwise it's not sustainable. So we cannot think that the research groups will go in each and every local community to implement projects, and this should be part of daily life of different communities.
Thank you very much, Marius. The next one is for Karina. So we mentioned earlier the EU valorization policies. Can you elaborate more on how can European policies support the engagement of local communities in social innovation?
Yeah, well, I actually have a kind of short answer for this because for several years now that commenting work programs from the European Commission, for example, or national funding, I have been trying to put more people in suggesting that instead of having really huge million funding projects, or at least complementary to these, we have a lot of smaller, really smaller funding, a bit like SIRENE, for example, that can be giving the frame for local communities to do something. Sometimes it's not the fact that a lot of money is needed. You need the framing and you need the push. And the fact of having an European funded project or a national project, sometimes it's not because of the money, it's because it gives you the perfect excuse to put people together. So in general, I think sometimes we put a lot of money in very big endeavors, in huge projects that, okay, maybe they are also needed, but one of them could fund maybe 30 or 40 local initiatives. And this would be, I think, a very good start point to people understanding that they can also have innovative things in place and be recognized by them, because all of this, all of the funding process is also a recognition process of excellence, of interest, of relevance. So this is a bit my push for several years now, and I try to always put more people into the discussion whenever I have the chance, like now.
Thank you, Verena. And then yeah, maybe I should also ask Marius, so could you explain how can European funding mechanisms be leveraged in order to support local communities' engagement in social innovation initiatives?
Yes, absolutely. So first of all, I fully agree to you, Karina, with your previous comment on allocating funding, full alignment, and yeah, this is, I think, a very important point. And that's why I'm a big fan of the missions in general, because this is actually the chance to go at citizens and community level, and to do this in a very democratic way. Um, and I'm sure that now we are in at that point where we should think on different methods of funding to link the European priorities, the missions, with the citizens, local and local communities and regions. I showed in my presentation that at least for Romania, there is a huge disconnect at the national level. Simply, European is disconnected when it comes to Europe is disconnected when it comes to European Code Against Cancer by the local and regional level. So it doesn't make sense to consider allocating funding from European level at the national level in order to have a local or regional impact, because this is not possible according to the stakeholder mapping and measuring their interaction. So the idea is to go more and more at regional level with the funding. A very concrete point for me is to put missions in the smart specialization strategies and the funding that for the implementation of these strategies, and for the countries, for the widening countries, I think it's a key to have dedicated funding for missions, part of the widening program. So these are two very concrete recommendations that I actually put them forward for a few months, and because this, I think, makes sense. Otherwise, would be really complicated.
Thank you very much, Marius. And then one last question for both of you from one of our participants. So, if there is, what could be the supportive role of entrepreneur health tech ecosystem on the synergy networking process? So, what could be the influence in local communities and co-creation?
Sorry, I couldn't hear you very well.
what could be the supportive role of entrepreneur health tech ecosystem on the synergy between local communities and policymakers or the co-creation process?
Okay, thank you. Yes, I see now in the chat. I don't know, Marius, if you want to go first or shall I?
Yeah, go first.
So maybe on a very quick follow-up of everything that was said, I think that if the entrepreneurs that are more connected to digital health in this case, or health tech, are fully aware of who needs to be considered in their local regional communities and what are the missing points to have whatever they are developing actually used and well used, then maybe they can be some of the ecosystem leaders. I mean, they could be the ones who also try to gather some people around them. It doesn't mean that it needs to be A, B, or C, and that there is kind of a leader or aggregator to the ecosystem. What matters is that people connect, and anyone that can drive the process is usually a good way to go. So I would say that it would be good that health tech entrepreneurs also felt this urge to gather the ecosystem around them. But please, Marius, feel free to compliment and fight me eventually.
Yeah, actually, yeah, I see a lot of course, a key role for the health tech ecosystems here. That this is very clear, and I see benefits both on the health tech ecosystems and for the communities. And I know that one of the biggest barriers for startups and entrepreneurs is access to data in order for them to develop their solutions and to test and so on. But going at the community level, I think this will open a huge opportunity for them actually to collect, to understand, to build models and so on. And the other way for the communities, especially the ones that are neglected, are not part of our conversations and initiatives around health, having entrepreneurs and startups with a focus on health, working with the community, addressing the real needs at the community level. This can be a way actually to cut some of the inequalities.
Thank you very much. So I think we have finished with questions. Back to Federica.
I don't know if you can hear me. Yeah. So thank you so much to Marius and Karina. I think we will meet soon in Brussels for the final event of SIRENE. So looking forward to meet you all. Also, Dimi, my colleague, that it's not easy to meet in person. So happy to see you all next week. And thank you so much for this insightful event. The recording of this event will be available soon in the SIRENE project website. So thank you so much for the panelists and also to all the participants that stay until the end. Have a good evening, everyone.
Thank you so much. Bye-bye.